No more diabetes. The number of people with diabetes rose from 108 million in 1980 to 422 million in 2014. Rates are rising faster in low and middle income countries than in high income countries. Diabetes is a leading cause of blindness, kidney failure, heart attack, stroke and lower limb amputations. Diabetes is a chronic disease. It develops when the pancreas does not produce enough insulin or when the body cannot effectively use the insulin it produces. Insulin is a hormone that regulates blood sugar. Hyperglycemia, or elevated blood sugar, is a common consequence of uncontrolled diabetes and over time can cause serious damage to many of the body's systems, especially the nerves and blood vessels. In contrast, the global probability of dying from any of the four major non-communicable diseases, cardiovascular disease, cancer, chronic respiratory disease or diabetes, fell by 22% between 2000 and 2019 in people aged 30 to 70 years. Symptoms of diabetes can develop suddenly. Symptoms of type 2 diabetes can be mild and may take many years to notice. Symptoms of diabetes include feeling very thirsty, needing to urinate more often than usual, blurry vision, feeling tired, unintentional weight loss. Over time, diabetes can damage the heart, blood vessels, eyes, kidneys, and nerves. People with diabetes are at higher risk for health problems, including heart attack, stroke, and kidney failure. Diabetes can damage blood vessels in the eyes, which can cause permanent vision loss. Many people with diabetes develop foot problems due to nerve damage and poor blood flow. This can lead to foot ulcers and possibly amputation. Type 1 diabetes is characterized by insufficient insulin production, requiring daily insulin infusions. In 2017, there were 9 million people with type 1 diabetes. Most of these people lived in high-income countries. Type 2 diabetes affects the way the body uses sugar, glucose, for energy. It stops the body from using insulin correctly and, if untreated, causes high blood sugar levels. This can cause serious damage to the body, especially the nerves and blood vessels. Type 2 diabetes is often preventable. Factors that contribute to developing type 2 diabetes include being overweight, not getting enough exercise, and genetics. Symptoms of type 2 diabetes can be mild. It may take years to notice. More than 95% of people with diabetes have type 2 diabetes. Type 2 diabetes was previously known as non-insulin dependent diabetes or adult-onset diabetes. Until recently, this type of diabetes was seen only in adults, but it is now increasingly seen in children. Gestational diabetes is high blood sugar levels that are higher than normal, but below the level that is diagnosed with diabetes, that occur during pregnancy. Women who have gestational diabetes are at higher risk for complications during pregnancy and childbirth. These women and their children are also at higher risk of developing type 2 diabetes later in life.